Hi, my name is Dr. Maria Iliakova. I'm a bariatric surgeon in Iowa City. Lately, some of my patients have been asking me about weight loss medications. There's been a lot of buzz on social media and in the news about new medications like Ozempic and Wegovy. Let's talk a little bit about the spectrum of options available to people who have extra weight. When we're talking about weight management, there's both medical and surgical approaches that people can take. First things first, we do an evaluation of everyone where you are now. This includes talking about your past medical history, your social history, your past surgeries, your medications, your family history, and even your medications. Once we have an understanding of who you are medically, we also want to understand what your goals are. Maybe your goals are to be able to bend over and be able to breathe easily when you do that. Maybe it's to get up and off the ground easily to play with your kids or grandkids. Maybe it's to get off of diabetes medication and to be able to treat it without having to need anything else. Maybe you have other goals in mind, like being able to fly or parachute or go to a swimming pool and feel comfortable. Whatever your goal is, we're here to honor that. When we have our first discussion with you, we talk about all the different options. No matter what, we do recommend nutrition counseling so that you can understand what you eat now and maybe how to eat differently in the future. Everything is about forming habits and being able to stick to things in the long term. We also recommend a mental health evaluation for all of our patients. This is something that can establish where you are now and also help you develop tools in the future to be able to handle things as they come. We also will discuss both medical and surgical options. Medical options do include a discussion of medications. There's actually 9 FDA-approved medications for weight loss. However, most insurance companies don't cover these medications. The cost of the medications themselves can range from under $30 a month to over $1,000 a month. All of these medications do come with some limitations, like how much weight can be lost, which is capped usually at 20% of your extra weight. So again, not all of your weight, but capped at 20% of your extra weight for most people. These medications also do come with some side effects and need to be taken for the long term in order to have long-term effects. But medications do have some advantages. They are accessible at most pharmacies. Your doctor or your nurse practitioner or other provider who's following you can prescribe them and can follow you and monitor you on a regular basis for great improvements in your health and quality of life. We also will talk about surgery. It does take certain criteria to actually meet the ability to have bariatric surgery under health insurance. For most health insurance currently, your BMI either has to be over 40 or over 35 with certain medical conditions like high blood pressure or diabetes. There are some exceptions to these rules, and some insurance companies have different criteria. In fact, the way that we want people to be able to qualify based on national guidelines from professional organizations that we belong to are actually much more inclusive. But overall, when you have a bariatric evaluation or a discussion about weight management, we'll discuss approaches that include nutrition, mental health, physical health and how you move your body, medications, and surgery. For more questions, please contact us directly. I can't wait to meet you and to discuss your options directly with you.